Well, COVID-19 and the pandemic is the public health crisis of the century. We haven't had, in the last 100 years, a public health crisis that shuts down our world.
It's a bold statement from a man who led the way on another global pandemic. Dr. Jim Curran, dean of the Rollins School of Public Health at Emory University, was at the forefront of the early days of the AIDS crisis, tapped to lead a CDC task force to figure it out.
If the trends continue as they are, I think we can predict that the acquired immune deficiency syndrome is a highly fatal illness.
A pioneer in HIV/AIDS prevention.
This is Dr. James Curran.
Dr. Curran led the nation's efforts in the battle against HIV and AIDS, a renowned global expert who examined some of the very first AIDS patients in America.
We did a report of the first 5 from Los Angeles. And then I went, that next day I went to New York to see one of the first patients in New York.
This is how he compares the HIV/AIDS epidemic to COVID.
The epidemic doesn't go away. 40 million people have died of HIV, and 40 million people are still infected throughout the world. There's no natural end to the AIDS epidemic short of a cure and a vaccine. With COVID, there's more hope that we could put an end to it because it's only 3 weeks away. The people dying today were infected 3 or 4 weeks ago. Why can't we stop it over the next 4 weeks? And that's our challenge. The advances in science are our greatest hope, and the people who interpret science.
The entire globe is involved.
All of science, maybe it's Tony Fauci, are the people that can provide us the best lens for our hope. And if we don't believe them, then we're really turning down a lot of the future. People have been predicting that there would be a widespread respiratory epidemic for decades. It's here, and we're never going to forget it.